Well, first we start here where the president has finally broken his silence on the cholera outbreak in Hammanskraal. 23 people have died in that area alone, and the death toll is sadly expected to keep rising. Authorities are scrambling to identify the source of the outbreak. Let's take you to the area now. It's ENCA reporter Pule Letswiti Jones is there for us. Hello to you, Pule. And apart from the president now recognizing the concerns and the issues around this, what exactly is he saying he's going to do, if anything?
Yeah, good morning, Gareth. Well, the president has said that the focus will primarily be on Hammanskraal, which seemingly is, of course, the epicenter of the cholera outbreak. And like you rightfully said, about 23 people dying, but also one person dying in the Free State as well. We were with the president yesterday in Mahikeng, where he was accompanied by members of the National Working Committee of the organization and the regional leaders of the area there. But he did touch on the fact that the cholera outbreak was unfortunate and that he'd be visiting the area. But while that's the case, while there's still the plan, on the ground where we've been for the past couple of days, we have been speaking to the nurses, community members, MECs, ministers as to how they're trying to contain this crisis here. But we also know that this issue cannot be, entirely contained if nurses are not up to the game, or not stepped up to the game, and their morale is low as well. To give us more clarity around this, I'm joined by, of course, Union Donosa, Mr. Mokhumuti Sileke from the Tshwane region. Mr. Sileke, thank you very much for speaking to us. I'm chatting to Gareth just about how seemingly there's efforts to try and contain the cholera outbreak, but nurses, most importantly, and of course medical, doctors playing an important role here. What's the mood like on the ground?
Thank you very much, and greetings to the listeners at home. The morale of nurses is very low, and you'd expect that, especially after the busy week that we had in terms of trying to contain the cases. They've been on the ground working tirelessly, and even though they are not appreciated at that particular level by the department. So the morale is very low, but I've just seen them today. At least the cases are going a bit down, and they are trying to cope. But we know that the morale will still remain low, and they won't do anything about it at the Department of Health.
How's it being low if we saw the Minister, of Health, Dr. Patla, having opened tents at Ganana, which is seemingly the epicenter in Hammanskraal, saying that there would be more doctors there? What's the mood like? What's the progress like there?
The minister is just enjoying to speak on the television and promise other things. We are here now as we speak. There's a tent that is erected in Jubilee Hospital currently as we speak. That particular tent has no one to work inside it now. The nurses, there's 18 here that also admit people from the cholera, that has cholera. That particular ward is closed as we speak because there's no one who's working there. So there's staff on the ground. There's shortage of staff on the ground. The only ward that is currently functioning is ward 17, which has staff. So the ministers, no, they promise and they make things on the television, but they are not on the ground to see whether what they promising is actually activated on the ground.
And with the president saying that he will be coming here, what are you expecting to hear? Will it yield any results whatsoever in terms of oversight role?
My brother, there's nothing we're expecting from the president of this particular country. He has not been there. Why he has not been there? He said yesterday that it's a national crisis, but he has never said his food here. Why is he not? It's not coming to this particular place here. But I'm saying to you today, if this was in St. Chudol, if this was in Waterloo, the president could have been there. The people who have just been here, we just only saw deputy ministers. Those are the highest level of people that we have seen. But other than that, the president has not been there, and he will never be here. If the president wanted to be here, he could have been here by the time this particular thing was at the peak. But now the president is just bluffing, and there's nothing we're expecting from him. Even if he was to come today, there's nothing he will do. This particular issue of rival water plant has been there for some time. He has been the president of this particular country, has been the deputy president of this particular country. This particular thing, it has been over there for 2 decades. They have done nothing about it. And we hear actually that there are claims that for the rival water treatment plant to be fixed, it will need around 44 billion to 6 billion. We know the country, the status of the country, the status of the money in this particular country. They won't do anything. They will never do anything. The people of Hammanskraal, they are still going to be subjected to this particular thing, and even especially when the cameras are off now, when they are still sitting at their home, they won't come here, they won't even care. The problem of Hammanskraal will still continue.
What's the call from Donosa?
As Dinosa was saying, please, politicians, they must not see this thing as an opportunity to make billions and millions, as they would also do. Here we are talking about people who are really suffering on the ground. Our people are really suffering. These people are going to just try. Let them come here and try to drink this particular water. You will see. Go to the hospital, go inside, see these particular people there. Our politicians must have heart for our people. That's what we call for, Dinosa.
Thank you very much. Of course, that's the Seleke, who's of course from the Tshwane region of Donosa. They're just particularly giving us, their clarion call to say that they want the officials who are leading, of course, various ministerial positions such as the Department of Health and Department of Water and Sanitation to move with urgency. Just about 2 days ago, we were in Kanaan. It's about 10 minutes from here, Gareth, where we saw the Minister of Health, Joe Pahla, of course, accompanied by other team of other ministries, saying that more doctors will be operating there, where tents have, of course, been erected to try and contain the cholera outbreak. We'll be going to the epicenter just to visit and see what's the update there and to see how nurses are really coping. But Donosa saying that the morale on the ground is quite low when it comes to nurses who are operating at the Jubilee Hospital. I did try to get comments from the CEO of the hospital, who said that she will only be available to chat to us on Monday. But of course, we are expecting an update from the Provincial Department of Health to try and get sense of where we're standing currently, how many patients are currently being treated, and of course whether the death toll has risen or not.
Oh, hopefully it has not. And as for the CEO of the hospital, not sure if she's aware that we're in the middle of a crisis at the moment, but only going to be able to talk to us tomorrow. I would suggest it's simply not good enough. Pulile Tswiti-Jones, though, doing whatever he can to speak to all of those who need to be doing something about this outbreak up in Hammanskraal. Pule, thank you very much. Back to you later, I'm sure.